Mae'r cyfarfod yma'n cael ei ddarlledu yn fyw fel bod yn cydweithwyr a'r cyhoedd yn gallu ymuno â ni, a fe fydd recordiad o'r cyfarfod hefyd ar gael ar ein gwefan ni. A fyswn ni'n hoffi cyfarch Ella Wilkins sydd yn mynd i fod yn cyfieithu i ni gydol y cyfarfod, a fe fyddwn ni yn symud ac yn tocio rhwng y Gymraeg a'r Saesneg. Diolch Ella. A croeso i bawb sydd wedi ymuno â ni heddiw. Ac fe na i gychwyn y cyfarfod ar hynny. Os oes gan unrhyw un gwestiynau i'w gofyn, allwch chi please codi eich llaw rhithiol a fe ddoi atoch chi yn eich tro. A pan ddawn ni at eitemau i'w cymeradwyo, fe fyddai'n gofyn i bawb wneud hynny hefyd ar y cyd. Diolch yn fawr iawn. Does gen i ddim ymddiheuriadau. Allai ofyn, oes na ymddiheuriadau? Dwi heb i dderbyn eto. Nag oes? Felly, fe na i groesawu nifer o bobl sy'n ymuno â ni heddiw. Katrina Furby o Archwilio Cymru, Ben Legicario Lusunde sydd yn aelod arfaethiedig o'r Byrdde-GIG, Fiona Davies, Pennaeth Safeguarding a Pobol Bregus, ac Alison Ramsey, cyfarwyddwr cyllid a gwasanaethau corffwriaethol NWSSP fydd gyda ni ar gyfer eitem 4.2. Dwi'n mynd i droi at y Saesneg nawr. Declarations of interest. I haven't received any notices of declarations of interest. Are there any that I have missed? No? Good. Thank you. And that will take us on then to the minutes of the Public Trust Board meeting held on the 21st of May. And I'll take us through, let me just scroll through to the minutes. I'll take us through page by page. And if you could indicate whether there are any comments or corrections, please. Page 1.
Yes.
Yes.
With thanks to Anne, I can see that the job title for Anne and Jill have mixed up somehow in the Irish chat.
2, 3, 4. Vicky?
I don't know which page, but it's section 5.1.0, and Norm and I have just been in communication over the last few days just to change some words in relation to risk and datex. So some pre-agreed words have been printed.
Thank you very much. That is actually page 8, so I assume there's nothing before that, but thank you, Vicky, that's great. Page 9. Agreed as a true and accurate record with those amendments. Thank you very much. So we also held an extraordinary Public Trust Board meeting on the 25th of June, and I'm just going to go through the minutes of that meeting so that we can amend if needed and agree. So again, page 1, page 10 on the bundle, page 1 of the minutes, page 2, page. Who's got their hand up? Sorry, Lauren. Sorry, Lauren.
No, sorry. It's just my title's incorrect in these ones.
Your title needs correcting as well. Thank you very much. Thank you, Lauren. Page 3, 4, and 5. True and accurate records. Are we agreed? Yes. That takes us on to the action log. And I am going to ask, first of all, whether we agree and confirm that we're content to close the actions marked proposed to close, which is action 4.1 and 2.1. Can I ask whether there are any issues with either of those actions before we close? No? Thank you. We have a number of open actions, 5.1, and this is an action for led by Jill. We have a date to be confirmed. Do we have any update on what that date is, please?
So you'll see. So we're meeting with a number of us are meeting with formally with the Cancer Alliance, CLICE, and Maggie's to formalise a relationship for us as we refresh our patient engagement strategy and to strengthen engagement and experience. Nan and I have discussed, and we have a plan, but we're awaiting dates for meetings. So that's why date to be confirmed. I expect by our September QSP meeting that we will have a plan on, what's happening by when.
Thank you very much. It's very welcome. And Vicky will have a date in September.
Yeah.
So that remains open. Thank you very much. The second is for Carl.
Yeah, thanks, Jay. It's due for September, but I just give an interim update on something which is particularly important around. We applied to Welsh Government for some additional resource and to repurpose some resource we'd already been allocated. So both of those were successful. So I'll bring that back then in the final paper. But as we are today, we met this week and I met with Carl and the team in both the service divisions. So my understanding of the position right now is fairly positive, but I'll bring that back in a formal paper in September.
Thank you. The next is for Anne.
Yeah, it's in relation to the visit to NHSBT and the impact on our strategy going forward. We set for a future meeting, didn't include in this one because the agenda was so large anyhow, but I'm thinking September time, the service have that brief.
Okay, so can we put that date in and can that come back to us in September? Yes,
yeah.
Thank you very much. We'll update that. And then we have a board assurance framework. And this is a collective action, which always makes me feel slightly nervous. Yeah. So would that be with you?
Yes, I think I would suggest that actually I'm the named, this post is the named executive for that action, and that we bring back an assurance report on this to the September meeting, rather than it being the whole of the executives. Obviously, I'll work with the executives to make sure that that happens.
Okay, thank you very much. Content? Yes? Good. And then we have, oh, Gareth. Sorry.
Diolch, Cadeirydd. Jyst i ddweud, yn y dyfodol, fysa'n fuddiol jyst yn ni'n cael diweddariad yn y papurau yn hytrach nag ar lafar yn y cyfarfod.
Ie.
Achos mae hon yn ddogfen
bwysig, yndi. Fydd y dogfen yma'n cael ei diweddaru nawr ar ôl y cyfarfod bwrdd, a fydd y newidiad yn cael ei adlewyrchu yn y fersiwn newydd o'r papurau. Bydd rheini wedyn ar gael, ond ie, dwi'n derbyn y pwynt, Gareth. Diolch. A wedyn mae gynnon ni, we have committee highlights for discussion, QSP, risks relating to trams. So we have a substantial paper on the agenda. So we will.
The points are covered.
The points are covered in the agenda. Yes, thank you very much. Thank you very much.
You missed the 06 item 78.
The cover paper for the annual report and accounts.
Sorry, the 78 for clarification regarding BAF 6.
Okay. Sarah.
Who has a hand up?
Sarah, who has her hand up. Yes, thank you.
Thank you, Chair. Yeah, just to add, so Lindsay as the lead for independent member for people and culture, and I have discussed the high level clarity around the BAF relating to people and culture, and we will be highlighting 3 separate risks which we will work through the new people committee to agree and define. Though for the purpose of the minutes, those 3 areas are firstly staff wellbeing and organisational performance. Number 2, leadership and management, and then thirdly, culture, values and behaviours. We will identify appropriate metrics to track that so that we can highlight how each pieces of the jigsaw impact our overall BAF position and allow us a much more rich conversation in that respect. So anticipate that that will be brought back after the first people committee discussion, Chair, if you're comfortable with that.
Yes, I am, if Lindsay is the chair of that committee.
Yep.
Yes, okay, thank you. Thank you very much, Sarah. Thank you. I've not been made aware of any matters arising. Are there any matters that anybody wishes to raise? No? In that case, we will go on to the patient story, which I actually found very moving. It's a reflection of a patient with dementia, and I'm sure that's something that very many of us can relate to. I'm going to hand to Fiona Davis, Head of Safeguarding and Vulnerable Persons, to talk to this story. We've all listened beforehand, but it is also going to be available on our website so that everybody who is interested can listen.
Lovely, thank you, Sarah. And thank you for inviting me along today to talk about Andy's story and really what Andy's story means for us within the Trust. Just for you to be aware, there is a much longer recording, so if you are wanting to hear that on the website as well, we can arrange that for you. And we just brought it down for the benefit of today's session, really. So let me just, sorry, I knew that was going to happen. So how does Andy's story really demonstrate our staff's knowledge? So Andy's experience really reflects a dementia-friendly practice, which we've aligned with the hospital charter. So our work plan within dementia is really aligned to the appropriate elements of the hospital charter. And that's been borne out in a variety of different ways, really. And we have a person-centred dementia care nurse, Diana Pinnell, and this is really her work more than mine. And so she's unable to be here today because she's on annual leave. So Diana, since joining in 2023, has made huge sort of a real drive and a passion in ensuring that patients who have a dual diagnosis of dementia and cancer are really well supported in our organisation. She has developed a Tier 2 and Tier 3 training. So Tier 2 training for dementia is rolled out across the organisation to all members of staff from facilities, estates, right the way through to our registrants and allied health professionals. And she's also introduced about a year ago our Tier 3 influencer training, which has actually developed 10 champions. And in the radiotherapy department, which is where this story is really based, we have 4 of those champions based within that department. And we've already identified areas that they can improve, from adopting a flagging system on their ARIA programme, and also identifying ways in which they can ask questions around learning disabilities and dementias in their pre-assessment planning clinics, which also includes as well identifying needs for carers assessments and carers pathways. So the champions are starting to include that within their day-to-day work. We also have developed environmental assessments. So radiotherapy was one of the first areas within Vallindra Cancer Centre to undertake an environmental assessment. As you can see, it looked at where we could have smaller waiting rooms, looked at social interaction and peer support, and the use of volunteers within our organisation to provide some of that support and social interaction. We also brought in the cognitive impairment symbol for patients within the first floor ward environment, but also toilet signage that was consistent across the the cancer centre, because if you, I don't know whether you know, but every toilet that you went to had a completely different signage on the door. So that was become more consistent. We've had yellow badges that have been distributed to all of our staff workforce across Fallinge Cancer Centre and Welsh Blood as well, so we've not excluded Welsh Blood. The staff through the training have demonstrated advanced communication skills, and as you heard in Andy's story, following his sort of when he did his distress thermometer in respects to how he felt after his first treatment, he saw an absolute difference in the communication from the consultant radiographer who came to speak to him about how he was feeling. And actually, he is a very active advocate across national steering groups in relation to patients' lived experience, and will often commend Diana and her training as part of these national meetings, because he says that communication from porter through to registrant is exactly the same. And that's his experience, which I think is really, you know, should be applauded. We've also recognised the impact of sensory and hearing changes on dementia and related distress. So, for instance, when we spoke to radiotherapy about Andy's experience, because we have shared that with the department so they could link in with the practitioners involved in his care, they were like, well, machines don't really sound, they're not really noisy for us. But for Andy's dementia, which is frontal lobe, noise is absolutely there. It's really much more significant for him. So we're linking in with radiotherapy to try and purchase some ear defenders for patients who would be able to use them. Say our head and neck patients wouldn't, but certainly they are there. And also other sort of aprons or cloths that will help to ease sort of the distress for people with dementia, and even something as simple as a fidget spinner, because when people become really anxious, they start to use their hands. So we're looking at purchasing a lot of different resources. And we are valuing and acting on patient experience and feedback. That very much is part of our focus. So where we are made aware, sometimes it's not always obvious, that patients' experience and feedback is either really positive. In Andy's case, it went from a negative experience to a very positive experience. We try and look at, are there any gaps? What can we do to improve that? So feeding on from that information, this is Diana, and I don't know why this corner bit doesn't populate, but I just want to point out really some of the external stakeholders that we actually link in with as part of our influencer training. So we have had our UK Dementia Research Institute come along and speak to our dementia champions about the research that they're doing. Have that link in with the Fallinge Cancer Centre, in with the trust. We also have a lived experience of Fleischite dementia coming to speak to our dementia champions, Dementia UK, and we also have really close links to the University of Worcester, which Diana uses for supervision, but to also to continue her professional development in relation to dementia. We've developed a dementia Padlet for our staff to use as resources, and you can see there we have the hospital chart, which develops our work plan. We've introduced the person-centred observation and reflection tool, which is where dementia champions can observe patients within an environment to see how they react emotionally, what distresses them, what makes them calm, and that can be used to make it more of a person-centred care plan. So that's been introduced this year. And we also have done our environmental assessments, and not just within the Fallinge Cancer Centre, but also in our satellite areas like Neville Hall Hospital. We've also delivered training to Neville Hall Hospital and to Maggie's as well, so we're trying to broaden that scope out. And we've also undertaken our Care Fit for Vip, so those are the values, person-centred approach, and our self-assessments in relation to that. So for Diana, who is managing this really alone, she's done an awful lot since she's been here, and I just, you know, and I think that is recognised by Andy nationally, but also through the story, through how his experience was. So thank you for listening.
Gosh, thank you very much. Vicky.
I mean, I think just to applaud Diana and the wider team, just in terms of all the work. I mean, it's really refreshing to see somebody with their passion driving all of that. at pace because it isn't that long in terms of establishing all of that. But I think the one thing from this whole story is about lessons learned. We all say, don't we, we want to be able to demonstrate lessons learned from concerns being expressed. And this is an ideal story for that. We've demonstrated that and beyond that. And it's just great to hear. I mean, before the board, I'd written down about advocating for patients right at the start of the journey. But actually, you've already described, haven't you, about actually the pre-assessment part of this and trying to get that identification. So I just applaud the work and thank Diane for all that she's been doing.
Thank you very much. Anne and then Jazz.
No, mine's just a question for us to think about, really. And that is, we're just wondering, with dementia patients, whether we need to make more effort in terms of diagnosis, because it's harder for dementia patients, so it's harder for families as well, having been there, just to understand sometimes what's going on and help people describe what they're feeling. And I just wondered whether that is something that we as a team at Belinda need to think about.
I absolutely agree, and that it goes widespread because obviously we know that patients with dementia are less likely to attend screening. Same for people living with a learning disability and people living with a mental health. So there are lots of works, especially NHS Performance and Improvement, who are looking at this at a much broader aspect and actually coming to us. I spoke with mental health colleagues in NHS Performance and Improvement this week who really want us to be part of that national picture, that conversation, how we can improve that. So it's absolutely on people's radar.
Jazz.
Yes, thank you. And thank you, Fiona, for kind of describing what it means for us, what the story means to the trust. I think there are some real lessons here around principles that I think we should be thinking about for all of our patients, actually. I mean, many people who are, coming for radiotherapy or coming for systemic therapy for the first time, anxiety does things to your memory. You can't hear, you can't retain information. And the slide that you had earlier, I was thinking, well, actually, that's good practice. Let's think about how we communicate in smaller rooms, giving people time, good signage. They're principles, and we do have an aging population. We should look at our demographics of the age that we're treating, actually, for cancer. How do we translate the story into kind of wider learning? So, because sometimes that dementia diagnosis is not easy also to define at the outset, and all people don't want a label of dementia. There's a whole thing around that. I'm interested in how we really learn from the story to change some of our practice. I just wondered what you thought about that.
Yeah, it can be really difficult, and a bit of it's almost like we need preparedness. So we need to be maybe mindful of that there may be somebody who has cognition issues. They may not have had a definitive diagnosis. We need to be, I think, improving our pathway relationships maybe with organisations like Dementia UK, so we can do maybe direct referrals, where we have to focus on what we can focus on, and then the experts around dementia need to focus on that. We have really good links for memory clinics within Wales, so where we do identify patients who may have slipped under the net, we do. Diana's got that really good approach, but it's the preparedness, and it's at the very beginning. And what we don't have is a good flagging system because of our systems, and they're national systems that we don't have a huge control about. Now, there is some work being done in an all Wales perspective around communications and accessibility in relation to not just, it started with patients who were deaf with capital D, hard of hearing, but again, that's realisation that it needs to spread, is that there's this All Wales group with 7 subgroups sitting under it, and one of those subgroups is around the flagging system in Wales. And so I'm part of that particular subgroup, and we have really good representation from the trust and all of the other subgroups as well. The hope is that if we can get a really good referral from whoever's referring into us, which describes how somebody is, whether that's a memory, cognition, or there is a definite diagnosis, we can start preparing from the moment they are booked with us. That can allow us then to provide that much better holistic person-centered care, which is then what we're aspiring to. So it's small steps, some things are in our control, some things are out of control, but let's see what we can do to sort of push that envelope really. That's, I think we've got to aspire to it and see what we can do.
And Jill,
Thank you. Thank you so much, Fiona, for presenting on Diana's behalf. Just a couple of things. So Diana's approach, having spoken to her about this, is across the pathway. So it is for all.
Yeah.
So when she's working with the champions, it is about, and she's been working with the team for NVCC, and we've had a presentation on signage and the approach there. I was also delighted to meet Diana. She was one of my nurses when I was a ward manager many years ago. And she left to run a nursing home, a family care home. So she's very, very experienced in care of older people. And, you know we've got an aging population and those coming through our services. So I'm really pleased. And she's innovative at every level, So, and she's empowering others to do that too. So thank you, Fiona.
No, she's a force of nature, Jill, isn't she? She really is. So, and we're really lucky to have her. So thank you.
so if I can suggest that the board writes to Diana and thanks her. Sorry, Kerry, did you have your hand up?
I didn't, but it was just as I was listening to you, thank you for your presentation. It was just as you noting that you're responsible for vulnerable, I can't remember the title, but yes, that's fabulous. And as we look at EDI across the trust, it strikes me that as we push for excellence beyond what others are providing, is there a strategic project that takes the learning from this project to deal with all sorts of vulnerable categories that the charity could maybe be involved in? Because the scaling up of activity is classic activity that we could utilise some of our charitable funds for. And it just strikes me that there may be an opportunity there for us to explore further.
That would be lovely if we could meet up, because yes, I have loads of ideas. You're absolutely right. This is cross border across all different aspects. We need to be providing equitable access to services. This needs to start, but it's a whole systems approach. So yes, if we can link in to see how we can work together, that would be fantastic.
Okay, thank you. So there's an action to thank Diana and the team, but also to follow up on this. And if I can ask you, Jill, as the executive to sponsor that, and make sure that you're linking in to Lindsay as the D&I lead and Kerry as the lead on the charity, and that we think about this holistically in terms of issues to do with access and patient experience, because that's what this is about. So 2 actions there. Thank you all very much. That brings me to my report, and the first thing to say is welcome Carl as our substantive chief executive, because although he's a familiar face, we certainly put him through his paces in going through the process of selecting our new substantive CEO, and I'm thrilled that you came through that with flying colours and that you've been appointed, and we need to support you now in making that shift, obviously, into what it is to be the substantive CEO at the same time as keeping a number of balls in the air. And we agreed as a board that one of our priorities is building that strong, sustainable executive team and integrated board, and this is absolutely a really, really crucial step along the way of doing that. So welcome and well done.
Thank you. Long month it was, I can tell you.
It was. And on the subject of new appointments, you'll see an update there on the appointment of the NWSSP chair, Susan Barnes. Susan and I have met a couple of times now. We're really fortunate in having somebody who has a lot of shared services experience, but also is working with the sector and understands commissioning. So we will be working really closely together, and we will be meeting formally quarterly as well as ongoing work. you'll see that I did the charity track. Oh my goodness me, what an experience. I mean, the people on that track, just amazing. And, you know, we have a real gem in that charity. It was just an incredible experience. So I know that other people will be involved. And, you know, John, we had your story as well around that time. And, you know, it just kind of touches people in all sorts of ways. So it was an absolute privilege. I've also put in a focus on palliative care. I am focusing on one service at a time now in terms of some of the services that I'm going to see. And yes, you know, it's an incredible service. And, you know, please do look at it there. And what we're going to be doing is using the information from that for our own internal communications as well, because it's important that we get to know each other right across the organisation, and to understand, just as we have now, you know, with this patient story, just the breadth and the expertise that we have within the organisation. I don't really have anything else to say on my update unless there are any questions.
It was just to add something actually, which was around the 3.2, which is around the chair's development session. And it was just to note that for the first time on that same day, there was a joint chairs and vice chairs meeting. And it was a recognition, I think, from vice chairs and chairs of the value of doing that. And that's something that had been kind of worked towards for some time, but under Neil's kind of new chairpersonship overarching, then it feels as though those opportunities are being actively explored, and that feels like a very good step.
Yes,
That's being taken.
yes, I agree. In that case, I'm going to hand over to Carl to give the Chief Executive's report.
Yeah, thanks, Chair. So colleagues have had a chance to read the report. I'll just pick out a couple of things worth mentioning on the theme of recruitment. Executive recruitment, first of all, I know we'll get a chance properly, but I know that Sarah Jenkins is on the call here. I want to congratulate Sarah first and foremost on her new appointment down in the West Wales Fire Service. I used to work in the fire service many years ago. I know Sarah will be an absolute asset to that. So congratulations to Sarah. We'll get a proper chance to celebrate all the energy and effort that Sarah's supported us with over the last 10 months. So, however, life goes on. Unfortunately, we've got somebody else coming on to carry on the good work that Sarah's done. So I'm really pleased, as it says in paragraph 2, with a successful recruitment process. And we're just going through final details on that, and then we'll be able to provide the board and the organisation with a bit more around the individual and start dates and so on and so forth. The second bit I wanted to draw out was fantastic. I attended the Blood Health National Oversight Group Conference on the 23rd of June, and obviously we are a key partner in that, but also there were colleagues from across the UK and also wider Europe. Fantastic, and I got talking to the Chief Executive of the Northern Irish Blood Service and also the Scottish Blood Service. So I'm really interested in terms of the similarities and the things they are starting to progress. So I think there's a real opportunity there for us to really strategically move forward as a system, but also say that 2 of our blood colleagues presented on that day. It was absolutely fantastic. So Chloe George and Simon Campbell Davis, it was just amazing to be in the audience listening, thinking, wow, they work for us. It was absolutely fantastic. And then last but not least, I just wanted to finish on the theme of the blood service, something not in my report, so I'm going to sneak this in, Chair. Just a huge thanks to blood service colleagues over the last sort of 6 to 8 weeks, because alongside the good weather in the evenings comes real challenge in the blood service. So we know that also leads to extreme weather, cancellation of venues, cancellation of appointments, people being unable to attend. Notwithstanding that, as usual, they've still managed to find plans to make sure we get collection of blood, platelets, and so on and so forth. So just a huge thanks from me personally and my exec team for all the energy and effort that's gone into sustaining that. So I'll end there, Chair.
Thank you very much. And if I can just say, I think that we should be sharing that with colleagues via our internal communications channels, because these challenges are, you know, we hear when they go wrong, but not necessarily when people are stepping up and doing amazing things. Thank you. Vicky.
I think it's just to add into that, because Carl spoke to us in QSE in the midst of all of that heat, and you could really feel the challenge of some of those logistics of managing those services. And I think Welsh Blood are a really good example, aren't they, of, we talk about business continuity, but they put it into practice a lot, and managing those logistics and the heat whilst looking after the staff welfare and public welfare is to be applauded, because it was amazing. So thank you to all of them.
Any other questions for Carl or issues that you want to raise? In that case, we are going to review the performance management for May 2026. I'm going to ask Carl to take us into this, and then he will we'll hear from the responsible executive directors.
Yeah, thanks, Chair. So essentially the report speaks for itself. I'm just going to pass across to Anne just to say a few words on overall performance, then Matt on finance, and then we're going to take questions as an exec team, because I think the report reads for itself. So if I can just pass to Anne to highlight any particular concerns, Matt on the financial position, and then we'll take questions as an exec team, Chair.
Okay. So I'm going to assume the report is read. It's a May report, and obviously we've just been through the detail of the next performance report coming through. So just to give some verbal updates, really, SACT continues to be challenging, but we met with the divisional and directorate team earlier this week. We went through a lot of detail in the report. There's things that we can support from an exec support on, but I think I was really, as were colleagues, really impressed with the level of grip and control that the directorate team have on the service, and the level of detail they're going into, and some of the solutions there that are materializing, which we'll expect to see coming through. I'm not going to say anything about radiotherapy, and then I just wanted to reflect, I think Carl's mentioned it, the adverse weather in Wales usually means snow. We have been dealing with, very, very high temperatures, which has taken all our mobile units out for WBS, which has a big impact. It's equivalent to about 100 units a month, and that's a lot. So the teams are working around that, and they're being very creative with clinics and trying to find other clinic venues, trying not to disappoint donors, but it's a tricky balance. We've got pre-Amber Alert in place for O positive. So we're managing that. The only other thing to say is on expired platelets, there's just a slight error. It says 12.5, it should be 8.0. But other than that, I'm open to questions.
Can I, Vicky?
I think it's just a query, really, because I think the grip and control, completely agree with you. If the board remembers, QSE had a workshop going back 2 months now. Yeah. Where we heard the detail of all of the work that was being progressed, particularly with SACT and radiotherapy. I guess the bit that I would like to see coming out in the PMF is actually, so what actions have worked? Yeah. Sufficient, we'll look at outcomes, we'll look at the performance, but actually what is it that drove that improvement? So we can start to look at the positives as well as the challenges that remain. That'd be really helpful.
Yeah, I think some of the key issues are, we've got 3 very well performing tumour sites, and some of the others are having some challenges just in terms of the daily rhythm. So there's a big piece of work to look at job plans and team job planning and all the other infrastructure that goes behind that. That's not a quick piece of work, but it's something that everybody's very committed to.
Lindsay. Oh, Vicky, sorry, Vicky first.
No, it was just in response to Vicky's point, sorry. So we are doing some work at the moment around PMF process, and we've got a task and finish group established. And one of the things we're looking at is best practice from other areas and the learning we can take. And one of the things that does come across from other areas is a really strong narrative around any changes that month we need to know about, what actions have been taken and mitigations, about any concerns. So that will build into the work moving forward. So I'm not going to promise you see change like next month, but by the time we finish that piece of work, hopefully that will be there.
Brilliant.
Thanks.
What is the timing for that? Okay.
We plan on finishing the work by December because it's a big piece of work, and because it's not just about how we present our information, it's about the mechanism behind it as well, and how we pull the information and process it. So it's a big piece of work.
Okay, thank you very much. Lindsay?
I wanted to just see if there was an update around the Welsh Birth Service and the overdue actions. So that's clearly something to be highlighted to us, is that there are been a number of overdue actions from incident action plans and from audit action plans, and there's a really helpful series of actions and mitigations that are underway. I just wondered if there's an update on do we understand if those actions are making a difference?
Yeah, and generally the feeling is that and the evidence is that they are making a difference. I think it's been a lot about training people to use the process correctly. So when we see old outstanding, that incident was to do with the outage that we had. And because it was an ongoing outage, everybody else kind of assumed it was somebody else's role to close it down. So it was, and there is a very good learning loop in Welsh Blood. So go back around it again and learn from it. If I can just ask the team to give us an example of some of those in a future.
Yes, I mean, there'll be an update the next time we see this, but it would be good to see that, you know, how we're understanding what difference that make, the actions make. Would be great.
Andy.
Just a brief comment in terms of cancer journey, you know, from point of suspicion or first visit to the GP through to treatment, chemo, radiotherapy, whatever it is. Of course, it is complex, it involves multiple stakeholders. So I think it would be to know a little bit more behind the work with other partners within the system, because often, you know, by the time people are referred on to Velindre, you know, at what point in that 62 days that is. So it's the whole system working together. It'd be just good to know a little bit more about that side, that partnership working. That then underpins the performance of Velindre. On when people arrive.
I agree.
Yeah,
and it's a very important point, is to understand per tumour site what the date of referral into Velindre is. We've agreed an informal standard, which is quite, well, it's a mandated standard in England, 38 days. And I'm working with Carl's team to make sure that those reports are available so that we can then share them with each of the health boards. But I think the devil is in the detail, because there's variation across health boards. There's examples of good practice, there's examples of things that we need to do better. And then we have our internal challenge of, once the patient gets here, to treat them within 24 days. That's critical to everything we do.
Yeah, I just wanted to perhaps look at it slightly bit further ahead with the board. So I think there's a number of things we're doing right now. The first is essentially making sure that with the resource we have available, we're efficient, productive, and the pathways are followed. So that's the first piece. The second piece, make sure that we deliver services in a different way to cope with increasing demand. So different types of workforce skills, more oral chemotherapy, more day case procedures. So where I'm getting to now, I still think at some point relatively soon, we will need to go back to our commissioners to seek additional funding, because as we well know, for SACT particularly, generally speaking, it's been about between an 8, 9 or 10% increase in demand year on year on year. So whilst we should do everything we can to absorb as much of that as we possibly can, there will be a need, I suspect, to go back then to have a broader conversation about commissioning for activity, and then secondly, commissioning for outcomes. So I'm just flagging that now. I know Kate and Anne and the team are working those business cases up, but I would also say there's still more things that we can do before we have to go and seek additional money. But I think just to get the board's head into that space in the next couple of months, because there will need to be a conversation with our commissioners about future demand and how we service that.
Can I just add to that, Chair? So the national assumption around SACT increase is 6%, and that's kind of uniform across the UK. Our assumption for new patients is, our assumption is 8% across the piece. But when we look at it last year, it was 13%. Now we break that down. and we need to understand what our increase is for subsequent treatments. And that's the really challenging cohort in a way, because those are patients that are living with beyond cancer. And because of both new drugs, we are treating patients for longer and they're surviving longer. It's a good news story, but actually it comes at a cost. And that's some of the narrative that we're going to try and describe for commissioners to help them understand just what we do.
Yeah.
If you want to add anything to that, Jess.
I mean, I think what I would say is that it is an area that, you know, we've made assumptions on the knowledge of our close health boards and partners in terms of what our business is. There is this focus on the first definitive treatment, the SCP pathway, getting your diagnosis, getting your treatment. But most of our business is actually in managing patients who either have metastatic disease, or we are giving them what we call adjuvant, which is preventative treatment to stop the cancer coming back, as opposed to being in that pathway of first definitive. So it's not the area that gets attention or targets or funding as a focus nationally. And I think what we need to do is really describe that business, and that is what is keeping patients alive and is impacting on the overall survival of cancer in Wales. And we recognise that. Part of our conversation this week with the team on our SAC improvement was, how are we going to do this differently? What's our horizon scanning process, and mapping the whole pathway and describing the work that we do. So we realise that that's an important area of focus.
That's very important for the board as well, isn't it? Lindsay.
Wanted to move on to a different area. So
Okay, well, can we just decide what the action is from that? Because clearly, you know, we're looking at what the implications are for us, not just now, but in the future. Oh.
Yeah, I mean, the action's already well in train. I think the work that Jazz has described, and yesterday we were the exec team committed to the world model, so it's far more complex, which allows us to simulate and model a number of different scenarios. And the second piece, Anne and Kate and the team are already well advanced. There are final draft business cases ready for us to consider, first of all into, and then for a potential discussion with our health board commissioners. So I think if I suggest we bring back a further report, probably in October. It seems to be probably timely, where we've got the August period out the way. We've QA'd the business case, and we've started those conversations with our commissioners, and we've also got a clear sight then on the procurement of the advanced capability within the world model. So I think October will be a timely point at which to bring it back, and also not forgetting, Vicky will be hopefully well advanced then with the team on the IMTP. So clearly that will feed into our planning process also. So that feels quite a nice juncture to have that conversation.
And we also have the cancer strategy, don't we? So thinking about how those things fit together, and in terms of, you know, the strategic input from the board and committees, but also the assurance factor of those. If we could leave that with you, that would be helpful. Sorry, Lindsay.
No, that's absolutely fine. I just wanted to kind of focus in on the people part of that, and just to kind of note really the value of having the information presented as it is. We note in the report that sickness absence is trending up, but I think the information there and trying to triangulate with other data will enable the new people culture and engagement committee to do some real kind of detailed kind of look at some of those different things. So I wasn't going to ask particular questions about that today, but I did want to ask a point of clarification, because in the list on the heat map and in the graphs on the previous slide, talks about Velindre organisations, and that's not a term that I think we generally have used. So sorry, apologies. So I just wanted to understand what we mean by Velindre organisations.
Where is that, Lindsay?
It's on 60 or 880.
Okay, so that's, yes, so we've moved on to the people.
Yes, because I think we were only going to go to finance, weren't we? So
yeah.
I'll bring Sarah in. Keep in that point, Sarah.
I was just going to say, Lindsay, I'd welcome that opportunity, and actually we're already proactively auditing the areas of concern in terms of increased sickness. So hopefully maybe even by the first committee, we'll have something for us to consider. Yeah.
It's just understanding what we mean by voluntary organisations, because it's not so before.
So just on that, because that's the first I've heard of that term for it. Valindra organisations, is that just a typo?
I think so. So we'll take that away. So yeah.
We've got enough nomenclatures flying around without creating a new one, I suspect.
Indeed, and apologies for missing that, board. Yeah.
Yeah, so no other questions. I'll pass to Matt just to for the financial health. Matt.
Thanks, Carl. So the report you've got in your papers, which I'm assuming everyone's read, is to the 31st of May 2026. So the month two report. So as I point out in each board and each committee, this is 2 months behind, and there is a more up-to-date month three report. I'll allude to some of the movements and some elements of the position. So the LTAs were all signed by the deadline with our commissioners. There's an ongoing group led by the Deputy Director of Finance looking at all of the LTA contracts, which might include and will hopefully include partly around the rebasing issue that we've got and other providers have been looking into. In terms of the IMTP financial plan, that was submitted as part of the overall IMTP 31st of March. We're still awaiting, I think, Welsh Government approval for that plan, which hopefully will come soon. 3 key financial targets. We're on plan to deliver revenue, financial balance. We're hitting our budget to payment performance and within our capital expenditure. The final bit then is on savings. So in this report, you can see that we still had about 1.2 million of savings that were classed as amber. So there's a RAG rating. So we've got roughly half of our savings still amber at this point in time, but I can confirm in the month 3 report, performance to month 3 against the target was only about 15,000 below our target. So we are delivering what we said we would deliver up to month 3. Part of the R&D targets were amber, and that was because we were going through a process with Healthcare Research Wales in terms of our submission to the VBAG scheme, in terms of seeking funding for a number of posts that will enable R&D to deliver the commercial income growth, which is one of their key savings targets. That revised bid has gone in. There's been positive feedback during the process of resubmitting that bid. So the likelihood is we'll get hopefully a good proportion of the funding we're seeking for posts. And those posts, as I said, are key to delivering that commercial income. And I'll leave it at that and take questions if there are any.
Thank you, Matt. Questions? Gareth.
Diolch, Cadeirydd. So gen I gwestiwn cyffredinol yn hytrach na gyn yn ymwneud gyda materion ariannol. Dalen ola'r papur. Yna adran fyna sydd yn ymwneud gyda risgiau. Ac ar dudalen 72 o 881. Ac dweud fyna ddim risgiau yn ymwneud gyda'r papur yma. Ac yn amlwg mae yna nifer o risgiau sy'n ymwneud gyda'n perfformiad ni. Ac byddai hwnna cael ei ffwblhau, dwi'n meddwl.
Dyle. Noel?
Yeah, so what page is that, Gareth?
72 of 881.
Yeah.
What is the risk?
Apologies. So on page 82.
So you have specific.
Yeah, on page 82 of 881. So we just need to correct that.
Yeah.
At the top, I don't know why they've messed up, but clearly on page 82 under the risk section.
Yeah.
Yeah, section 4. it does reference obviously that there are risks,
So
individual
it's,
risks.
it's an administrative.
Yeah,
Yeah.
we just haven't for
Yeah.
some reason corrected that. Thank you, Sarah.
Lindsay?
Yeah, I just wanted to ask about risks actually, on that page under 2.5. I wondered if there was any update in relation to those. I mean, you covered in some senses some of those in the general introduction, but particularly we know same day emergency care fund, if there's any update in relation to that or any of the other risks.
Yeah, so our chief exec has had conversation with Hal Jones, the director of finance for NHS Wales. The funding was clearly set out in the allocation letter to health boards to come to Velindre as a pass-through. Hal has recognised that. I think we're still waiting for that formal confirmation from him that that money will be flowing to us through the health board. So that's as much as we've got at this point in time, but I anticipate that we will be getting that.
It was under question, I think, when it was coming through committee, that was under question.
Yeah.
So that's what we've done.
Could I just add to that for reference? Yeah, I've spoken to Howell, he's the director of finance working with numerous times. My position is the same as Matt, and slightly different. However, that is our money. And there's been an admin error there end. So that's the position we're at because the allocation is quite clear, which was arrived with us in December. And we provided all the evidence to support that allocation. So we're just hopefully waiting for a letter just confirming there's nothing, it's just noise. So I will chase that again. I've spoken 3 or 4 times and it says I'm going to get to it. So I'll take a formal action actually if this from this meeting today because it's really important for lots of reasons, isn't it? So yeah.
New hand, Gareth?
Just to fod yn glir, Cadeirydd, roedd y mwynt i ddim just yn hyswllt yr adroddiad ariannol yn yr un
Na, oedd e cyffredinol. Yn union. Ie, diolch. Yn ei gywir o hwnna.
Ie, dwi'n meddwl bod gwaith i wneud i ymlynu'r risgiau cyffredinol, y papur sydd yn cyflwyno fframwaith yn ei gyfanrwydd. Ie. Mae eisiau cryfhau hwn.
Ac os nag oes dim mwy o bwyntiau fyna, mae hwnna'n arwain ni i fewn i risg. Yn dda iawn, diolch Gareth.
Diolch yn fawr iawn, Gadeirydd. Mae papur yn cynnig dywedariad i'r bwrdd ar y gofrestr risg gyfredol ac yn cynnig sicrwydd yr modd rydyn ni'n rheoli a dadansoddi risgiau. Mae 15 risg ar y gofrestr, 10 risg ansawdd y diogelwch sy'n sgorio 12 ag yn uwch, a 5 risg mae meysydd eraill sy'n sgorio 15 neu'n uwch. Ers y cylchadrodd diwethaf, mae 2 risg newydd ar y gofrestr o wasanaeth canser Velindre, sy'n ymwneud yn benodol â llwybrau esgyniad, mynediad amserol i gyngor clinigol trwy'r llinell gymorth a gallu a galw ar y llinell gymorth. 4 risg wedi lleihau o dan y trothwy y tro hwn, ac mae'r themau yn parhau. Mae diogelwch cleifion, capacity y gwasanaeth, mynediad triniaeth, dibyniaeth digidol a gwydnwch sefydliadol yn parhau yn themau cryf yn y gofrestr. Mae'r papur hefyd yn adlewyrchu gwaith archwilio pwyllgor ansawdd, diogelwch a pherfformiad, a ganolbwyntiodd yn benodol ar yr angen i gryfhau gweithrediadau risg, dyddiadau, targed, naratifau lliniaru, disgrifiadau risg a rheolaethau presennol. Ers hynny, mae adolygiad o reolaethau ar gyfer pob un o'r risgiau sydd ar y gofrestr wedi cael ei gwblhau. Dwi ddim wedi nodi y rheolaethau yna o fewn y gofrestr, ond ni wedi adolygu i sicrhau bod nhw yna. Gofynir i aelodau'r bwrdd felly i nodi'r proffil risg cyfredol ac mae'r raddfa sicrwydd yn aros ar lefel 3 am y tro. Diolch yn fawr iawn.
Diolch Non. Allai ofyn os oes yna unrhyw gwestiynau neu sylw ar y risgiau o'n blaen ni heddiw. Lindsay.
Thank you. I noted this time that there are a number of risks on here where the current rate, the inherent rating and the current rating are exactly the same, which would indicate to me that any of the actions that are in place are not making any difference. They're not actually mitigating that risk or ameliorating it in any way. So I just wondered, as part of the review that you've described then on how much of a consideration has there been around why that is, and therefore what further action needs to be taken, because that that's the kind of area where if actions aren't making a difference, we need to be thinking differently about how we're managing those risk areas.
So I'm happy from a process point of view to answer that question.
But then
In terms of that review of controls, Mel and I have been discussing that the controls actually feel like actions that have in some cases been delivered. And I don't think we're seeing within DataX a real true understanding of how those mitigations, how they are impacting on the current score and future plans to further mitigate the risk. So I think there is a very defined piece of work that we're working up at the moment to work with the services to make sure that actually we understand the difference between the actions, the controls, and their impact on the risk. There's a big job of work. I mean, the good news is that the controls are there, and that section is a really strong section, but I think it's getting confused with, in summary, with the progress notes on occasion, and also on some of the actions and the action section itself.
And I just wondered then if any of those risks that would appear as though the actions or the controls aren't making any difference, the actions aren't making any difference, whether there's any, if risk owners aren't here today, can we have some kind of progress narrative? I mean, yeah, you are able to speak to it, Anne, but if it's further work, then we do need to hear directly about, you know, because this is about giving us assurance that risks are being managed, and I'm not getting assurance from those scorings.
Okay, that. Let's go to risk 3832. I think that's the one of the ones that you highlight, where the inherent risk is the same as the as the starting point, and that's to do with close. Now, I'm not a technical expert, so I'm going to have to give you my description. It's to do with closed system that's used for the delivery of chemotherapy drugs. We're piloting it, and we've piloted a couple of systems, and it's going through the procurement. So the risk was put on the risk register. The action was to get systems and to pilot them. The risk itself will not be reviewed until we have procured that and we have that in place. So that's what that's waiting for. Just
I think there is, I mean, perhaps it's useful to just say that's a good example of where the conclusion in the mind of those assessing this risk is when we have concluded it, when we have got that system in place. I guess for the assurance for the board is that we are, you know, there are a number of steps that are moving us towards that, such as doing the pilot, such as a process around procurement, which has already started. So it's about how we communicate that, I suppose, because what we don't want to do is give the false assurance the risk has come down. Effectively, we want to hold that risk until we are sure. We want to give you the assurance in the narrative that there is some progress happening. I think many of the others that I've looked at are similar in that they are dependent upon a digital solution.
Yeah.
So there's a question for us about how better can we describe the journey towards those points, which sometimes are going to take months. If not years in some cases, but we need to perhaps take away a kind of thinking around how we provide that assurance in the context of something that is going to take a long time.
Yeah, that's it exactly.
Actually enabling us to understand better what actions are, what difference those actions are making. They are getting us there rather than they're not making any difference at all.
Yeah, okay.
I think with those digital risks, you know, we've escalated via the digital route, we've escalated via the clinical route, and we're continuing to have those conversations. And I think we had a fairly positive meeting with the medical director of DHCW, but there are some system issues that will take a while to resolve, assuming there's the ability to do that.
Andy.
I think in the past we've commented that often the target dates would look quite ambitious. Above the what Anne was referring to, this is a new risk 3969, page 2 of 8 in the table. This is a new risk around escalation of patients to senior decision makers. We have a starting risk at current and a target of 8 with a target date of the 10th of July, which is now. But then there seems to be quite a lot of work to get there. There's then the 8 points around mapping escalation pathways, roles and responsibilities, etc. So again, it doesn't quite match up there, given it's a new risk.
If I can add to that, because we had that discussion in QSE, which is fantastic. So I was going to raise that point. I think the 2 new risks are very similar wording when you look on the left-hand side. But then actually what we heard back was a description of actually there was confidence that those actions would be achieved by the end of July, which is tomorrow. But I think, again, coming to the board with only a few weeks, it would be helpful to have that update, because otherwise it looks like a long list of actions. And we didn't still really understand why there was similar wording on both risks, and can they be amalgamated? And I can't remember the outcome in terms of amalgamating those, but that was a discussion.
It was to do that.
Yes, it was.
But not for us to do it. It was to do it in conjunction with the service.
And the reason they had listed them as 2 separate was one was very specifically about calls through to the centre, and the other was, so it was people outside trying to escalate, and the other was inside. So,
If it's on this point, Gareth, no.
With Timmy.
Okay. So on this point, I was struck by that as well, and I was also struck by the fact that what this is about is patient access and the patient experience, and it's a quality and safety issue, and that wasn't really coming through to me in terms of the way the risk was expressed, and also how we know that whether the mitigations are working. So I think we're agreed that there is a huge amount of work to do on our general approach to risks, and our understanding of what does risk mean. So it's opportunities foregone, it's experiences impacted, it's outcomes impacted, and that is really at the heart of what we're all about. So I think this is a good conversation in terms of how people view and think about risk, and use it as a way of really considering what that means for patients and donors, and how we measure that and how we know. So I don't know if there's anybody on
that. Add on to that point, Chair, if I can jump in before going. It was just, I think it shows we've had a number of discussions. And actually the work up to the points that you've just said and to other points, it needs to be matured before it comes to the board. And that will be demonstrated by having that forum. The rigour and the sort of timeliness of that will demonstrate in what we see at the board.
And also what the risk register is for. It's the process is a means to an end. It's not the process, it's what happens to patients and donors. Did you want to say something on that?
I mean, I think for this new risk, I suppose, in terms of providing some assurance to the board on that long list, I mean, I know that has been escalated, and there's been an urgent piece of work. There's been a recruitment of an acute physician on the ward. There have been many actions that have happened because they needed to be urgent. So I kind of wanted people to, we read that description. It is quite worrying, and actually it came out of that there was a background of an incident which we have responded to. I think partly what it's describing is there needs to be a sustainable plan to this, because we need to look at the way we work and how we organize ourselves on call, etc., which might take a little bit of time. But there's been an immediate mitigation to the immediate risk, if you like, that was flagged as part of this.
Thank you. We'll have Gareth and then Carl. What are you pointing at?
Sorry, Chair, I was on that point from.
Oh, right, okay.
So Jazz has highlighted the internal, and I guess the other two, it's the numbers of calls coming through to the external switchboard and the treatment helpline are significantly, so that's the external versus internal, just to finish. Thank you.
Okay. Gareth.
Oeddwn ni'n edrych ar dudalen 5.8 ag ar risg 3.8. Ag mae'r dyddiad targed yn y fan yna hefyd, y diwedd mis Gorffennaf. Ond o'n i'n edrych wedyn ni ar y nodiadau yn y golofn ar y llaw dde, ac dweud fod dim unrhyw gynnydd o gwbl, serch bod ni'n cael cyfarfodydd wythnosol gyda DHCW. Ac fel ydyn ni'n mynd i sortio hwnna mas yn gwir. Da ni byth yn mynd i cyn diwedd y mis, fysa ni ddim yn meddwl, dy Gwener. Felly, beth yw'r cynllun ynglyn â'r risg yna sydd yn dal ar 1 ar 15 ac wedi bod yna ers mis Mai 2024.
Carl, ti'n dod fewn ar hwn? Nee.
Yeah, happy to do that. Yeah, this is the integration of a live service, so FEDIS service, and integrating that into the national systems. It has been subject to lots of escalations with DHCW, and as I think Anne previously highlighted, we did raise this formally with the exec medical director of DHCW at the beginning of this month to ask him to get involved with the implementation. It is moving forward slowly, not at the pace we would like to see it moving on, but it wasn't a blocked position. Those escalations have got it into a position where it's moving slowly, but not at the pace we would like. So we're keeping that pressure on. The team in WBS are providing good support in terms of making sure that we get that across the line as soon as we can. But like I said, it is a long-standing risk and the challenge with integrating things into the national system. Already got covered as one of our digital risks in the pack as well. So we've got coverage across it. We don't necessarily see the traction, but the work we had with Ridian, I think.
If we can just add to that, I think the conversation we had with the DHCW medical director was really helpful in that it wasn't in his line of sight, and that he has taken an action to work with us to try and progress it. So I mean, essentially, and we understand the position for DHCW, they have many competing priorities. I felt that at the end of that discussion, we had moved that up the priority line, and it is about Edwin is in touch regularly now, so we've also created a relationship, and that's the progress that we've made. I guess the facts remain as Gareth has set it out. We haven't got a conclusion, and I don't believe we would have one by the end of the month. So that will need to be reviewed.
Can I ask you to think about this and think about how we're reporting on this? I appreciate, what's in our control, what's within our influence, and what is in neither. So that we have clarity around some of that in the way that we're reporting this risk. Carl, you had another point to make.
Yeah, and it was just on another one of those stuck risks that had the inherent and the current the same, which would be 3646, which would be WLIMS, which is Laboratory Information Management System. So again, this is again for the Welsh Blood Service, and they're at the back of the queue in terms of the tranches that they're rolling out. So they see a lot of movement in the dates. We reported September 26 in the progress notes. That's now moved to November. So we're kind of seeing it kind of moving out. We are weekly escalation meetings in with the SROs from all the health boards to try and hold the position. But it's an interesting one, isn't it? Because the work with Welsh Blood Service and our preparation work is green. We've done everything we possibly can to be ready. So like I said, it looks like the trust has a problem with WLIMS, and we do. We have to get the slot. But our preparation work has gone really well. And I'd say Welsh Blood Service have also gone above and beyond in that they're putting resource into the national programme now to help other areas. We are stretching wherever we possibly can to hold that position. And it's one that I think will tail off very quickly once we get a confirmed date. So it will stay at 20 and then it will come down very quickly once we get a confirmed date because we're ready to go.
Is there anything we can do to help a chair-to-chair conversation or anything?
Well, I suppose everything helps, doesn't it? That's the starting point. Conversations help. I think it's Jazz's earlier point. I mean, as part of the overall system, we understand that there is a huge number of priorities And that's the discussion at a national level that's been happening. It needs to stay at a national level because ultimately something's got to come first and something's got to come 21st. So the thing we're trying to work out through the DDAT board, which Jacqueline Tottido chairs as Director General, how you get a better view on national priorities and then understanding levels of risk. So I think it would help, Chair. I'm not sure it's going to necessarily radically change where we are right now. It's just a really big challenge in us because where we go right the way back to the conversations we've been having as a system and as a board, we know that digital is absolutely pivotal, enabling the services we'd like to see now and in the future. And we also know for Wales and for other UK countries, digital is not where we all want to be. So there's a number of different layers to that sort of conversation. But I think it would be helpful just because all we can do is keep influencing and flagging, isn't it? So I think we should do that.
So outside this meeting, let's see what we can do to unlock this. Kerry and then Lindsay, and then I'm going to draw this to a close.
So my comments more broadly on the assurance framework and the management and the information that people have been requesting to seek further assurance. And I think, Carl, you alluded to it then. When you look at the register and you look at stack risks, I think that was a fabulous term, by the way, because you look instant as an IM with a pack this size, you look at the high scorers and then you realise the high scorers are the stacks. What I'm not getting ahead of the meeting is an understanding, I think this comes back to Lindsay's point, of the mitigating actions as opposed to the actions you're doing. And some of the action updates we get feel very tactical, whereas actually what I'd like to understand is what are the options on the escalation route? So, and I think Sarah's example there was right, well, what can I do? And involving the chair may be the NAPAP solution, but as a board, I'd rather understand what are the escalation matters in what period of time so we can help strategically support you. Because despite some of these being stack, and you know, I listened to Jazz or Anne and Gillian giving me the information, after 3 or 4 board meetings, I'm always convinced you'll tell me why, but beforehand I don't understand what the strategic route is. So something on escalation routes and options, because we might not, we might say, let's move the date. Would help.
That's really helpful. Thank you very much, Kerry. Lindsay.
I was going to go back to the previous point, but I just to follow on from that, and actually there are some examples of that in some of our board papers where we're looking at and more in this afternoon's meeting where we're looking at escalations and escalation routes. So
there's a model there we can replicate.
Exactly. I was just going to go back to the other point, which was about related to DCHW and kind of strategic engagement. And just to note that the vice chair of DCHW has been arranging meetings with all vice chairs of health bodies individually, and my meeting with him is in September. I let Carl know about that some time ago, so I will make sure I'm absolutely fully briefed then about that as another opportunity. It won't make the difference, but we need to be saying the same things in all the places we can say them. So I'll make sure I've got a full brief before as well.
Carl, your hand is still up.
Yeah, just to come back in briefly and just triangulating this with the audit committee highlight report, because that talks about there not being right now somebody as a digital IM.
Yeah.
The health boards would have somebody in the seat as a digital IM, would go along to the digital IM network with DHCW and influence that route. So just as we look through the governance, that might be an opportunity to think about how we do it. If we could nominate one of the independent members to be a little bit more involved in digital.
Really good point.
Yeah.
Yeah.
We did have that previously with Stephen.
Yeah, because Stephen Harris took that role on.
So IMs, have a think.
Pretty enhancing opportunity.
Yes.
There's a model at UCL. Our visit to UCLH also did demonstrate that was a big priority, and they had an IM dedicated actually to digital.
Thank you. Okay, thank you. That was a useful discussion, which takes us neatly in to the next item, Mrs. Bath, for you, please.
Ie, mae'r papur yn amlynesu diweddariad y bwrdd ar y fframwysicrwydd. Mae'r papur yn cadarnhau bod e wedi cael ei ystyried yn ddiweddar gan y bwrdd rheoli gweithredol, pwyllgor dybri strategol a'r pwyllgor ansawdd diogelwch a perfformiad a'r pwyllgor archwilio beth amser yn ôl erbyn hyn. Mae'r ffordd o'r trafodaethau hynny wedi bod yn gadarnhaol ar y cyfan, gyda aelodau'n cydnabod bod y ddogfen o leiaf yn haws i'w darllen ac yn fwy hygyrch erbyn hyn. Fodd bynnag, mae'r papur hefyd yn tynnu sylw at nifer o feysydd lle mae angen gwella ymhellach. Er enghraifft, mi fydd fersiynau'r BAF yn y dyfodol yn cynnig esboniadau mwy eglur ar pam mae'r sgoriau yn sefydlog a phryd disgwylir lleihad neu gam newid yn realistig, sydd yn berthnasol iawn i'r sgwrs ni newydd ei chael. Mae'r papur hefyd yn nodi'r angen i wella gwelediad ac atebolrwydd dyddiadau unwaith eto a'r camau lliniaru. Fi jyst eisiau nodi cyn cwblhau o dan a hebroed y cart cynnig ceffyl, o dan y strwythur newydd ar gyfer pwyllgorau'r bwrdd, bydd pob risg strategol yn cael ei dyrannu i bwyllgor arweiniol i'w archwilio o hyn allan. Ac fe ddyle hyn wrth gwrs gryfhau y llwybr sicrwydd o'r bwrdd rheoli gweithredol y holl ffordd fyny trwy bapur integredig i fwrdd yr ymddiriedolaeth. Am y rhesymau dwi wedi amlinellu, mi fydd yr raddfa sicrwydd yn aros ar lefel 2 am y tro.
Diolch, Nawn. Oes na unrhyw sylwadau neu cwestiynau ar y fframwaith? A diolch am yr holl waith. Dyn ni'n gallu gweld hwn yn datblygu ac yn gwella. A dwi'n gwybod bod yna lot o bobl wedi bod yn trin a trafod er mwyn dod i'r pwynt yma a bod yna gyfle eiraidd i ni o ran y pwyllgorau newydd. Oes na unrhyw gwestiynau neu sylwadau? Mae gennym ni Gareth a wedyn Lindsay.
Diolch, Cadeirydd. Dwi'n diolch am y gwaith sydd wedi cael ei wneud ar y fframwaith. Ers i ni gael y fframwaith yma o'r cychwyn gyntaf, mae wedi fod yn waith ar y gweill, a gweud y gwir. Ac fysau yn neis cyrraedd pwynt lle dyn ni wedi setlo ar fersiwn ohono fe nawr, a bod ni ddim yn wneud, dwi'n gwybod rhaid ni adlygu fe yn gyson, ond fysau neis cael fframwaith bod fydd disgwyl o ran strwythur yn symud mlaen. So dwi'n gobeithio gyrraeddwn ni'r pwynt yna yn weddol fian.
Fi'n hapus i ddod dwi'n meddwl bod ni wedi cyrraedd. Dyn ni ddim yn newid y templed ar y cyfan. O gwbl, beth ni yn neud fan hyn, beth o'n i'n cyfeirio ato fe, diweddaru'r cynnwys yn benodol. Mi fydd gwaith pellach gyda line of sight, wrth gwrs, yn mynd yn ei flaen, mwyn meicnodi beth sydd ganddyn ni fan hyn yn erbyn beth sydd yn bodoli mewn llefydd eraill. Mae'n broses barhaus ar rhyw lefel, ond dyma'r templed i ni wedi defnyddio ers i ni gytuno ar y risgiau strategol nôl y mis Mawrth.
Diolch. Is it on this point, John?
It's just on the allocation.
Okay, I will then go round Lindsay, Vicky, and then you, John.
Thank you. And it is great to see some of the developments, and by and large, I think there is an improvement in how it's being used and how it's being contributed to. I really value having the red showing, the current updates. That does make such a difference. Again, going back to Kerry's point, it draws your attention to what's current and what's changed. So that is really helpful. There is still more work to do though. And so, for example, on BAF 1, I think it's really helpful. A good example here is that the risks that are associated with the strategic risk are kind of set out very clearly. They're not in some of the other maps where there are no associated risks shown in this. And I can't quite believe that if we've got a strategic risk, there aren't other associated risks for those strategic risks. So we certainly need to think about how that can be used more. So that's a positive of that one. I would say, though, that unfortunately, under the controls and assurance, we only have controls and assurance about the Welsh Blood Service. I was to take that at face value, that would tell me we have no controls whatsoever within VCS and no assurance, which I don't believe is true. But it's really important that this does get used. I've said this, and people will hear me say this in any opportunity. This is a really valuable tool for us as a board and in the committees. And unless it's given that kind of commitment by the executive and by sponsors, we can't get to use it the way we need to use it. So I would really welcome seeing that change by the next time.
We come to Carl on that point.
Yes.
These conversations are happening.
They are happening, but I think it's Jazz is the only one of the Jeff. You need to see it in the papers.
Yeah.
So Anne will pick that up with colleagues in the cancer service, and we will commit quite rightly to having this resolved for the next meeting.
Thank you. It's an action. Good. Vicky?
I think just to say that we had a significant discussion on this in QSE, and we focused with Jill's agreement on O2, which was the quality and safety element, and discussions before QSE with Jazz and Jill, because I think we need to focus down at committee level in some detail to gain assurance that the executive oversight have reviewed this in sufficient detail, and there's some acceptance that there needs to be more detailed review of these before they come to committee stage. And the example in O2 is that the controls and the assurances are not clear. So some of the controls that are described, or the gaps in controls, are actually controls, not gaps in controls. And so for me, that showed that there had not been enough detailed oversight of the document. And again, that goes back to what forums we have to review this, and the oversight, and therefore the assurance that all the content is, to Lindsay's point, that we need to see at the board. We can then have the discussion, again to Gareth's point, about the real issues that we need to be discussing at the board level.
Thank you.
It's following on from Vicky's point, really, because I see taking for the Performance and Finance Committee BAFs 04 and 05, I would expect that to be a standing item on the from the staff of that committee, and therefore to the executive session, and provide the committee with the report so we can provide the assurance. So I guess all the committees coming to board as appropriate, where these are strategic risks, so they should be coming into board in some format. But I was going to make the other point that when we've got the 4 and 5, got the Finance and Performance Committee, I'd like to see who the nominated exec, because I guess for 4 it would be Matt, maybe for 5 it might be Lauren, just so that they know exactly that the expectation for that committee, they're going to come forward with an update around, I suppose, because they're making assurance to the Finance or Performance Finance Committee. It's those individuals making or helping inform the Performance Finance Committee of the assurance we need to provide to board.
I think that's a really, really important point, and it's linked to the accountability work that the executive team are working on, and it's part of the what we'll be discussing this afternoon. And so that everybody has clarity, and we're also obviously establishing a chairs forum, which will essentially be all IMs, because all IMs are chairs, which will enable us to look at some of this as well, and how we improve that. Gareth, and then I'm definitely going to bring this to a close, otherwise we won't have coffee.
Definitely. Newydd sylwi fod dyddiad y risg yn bob un heblaw am yr un ola, sef risg 8. Mae'r dyddiad yn Ebrill eleni. Nawr, dwi'n gwybod bod ni wedi adolygu'r risgiau yma, ond mae rhai yn nhw'n hynach na dwi'n meddwl falle.
Dwi'n mynd i stopio ti fyna, reit, achos dwi'n credu allan ni bigo hwnna yma tu allan i'r pwyllgor. A dwi'n mynd i adael i pawb gael paned o goffi, ac dyn ni'n mynd i ail ymgynnull fan hyn am, faint dyn ni angen? Mewn 10 munud, so byddwn ni nôl yma am 20 munud i hanner dydd. Diolch.
You did.
Thank you.
Yes.
But I didn't see the ones in the middle, so.
Okay, everybody, we're just unmuting and starting again. Thank you very much.
Oh, yeah.
Can you let me know when we're ready to go? We're ready to restart. Welcome back, everybody. We are now moving on to an item on the terms of reference for the new committee structures. That is going to be led by Non.
Thank you. Colleagues, I present this paper to seek the board's approval for the revised board committee structure arrangements, including the updated terms of reference, proposed committee membership and executive lead arrangements. You will also see that a QIA and an EQIA have been developed and have been approved / signed off. This is an important final step in implementing the committee structure we previously agreed as a board, and is intended to ensure that our governance arrangements are clear and aligned to the Trust's current strategic priorities, assurance needs and operating context. The work has followed a significant period of review and engagement through various forums and discussions over recent months. And the revised structure is designed and will reduce duplication of effort, strengthen accountability, improve the flow of assurance up to the board, and provide greater clarity on the role, delegated authority and reporting arrangements for each of our new committees. I'd like to take the opportunity to thank everybody around the table who has contributed to this work, board members, colleagues, independent members, and the corporate governance team. In particular, I would like to thank our colleagues from Line of Sight who aren't here, unfortunately, for their support. Diolch, John and Emily in particular, and also to Lindsay for her leadership and focus in helping us move this work forward, checking over all the details, but never losing sight of the big picture and strategic intent. Subject to our discussion today, there is a lot more work to be done over the summer to support the transition into the new arrangements. This includes the development of operational documents and a governance handbook setting out roles and responsibilities and ways of working so that it isn't only us who understands the purpose of the new committee structure, but the rest of our organisation. And engagement with those services is well underway and will continue into September ahead of committees formally adopting their terms of reference and cycles of business during the September committee cycle. There is also work to do on the terms of reference for the Charitable Funds Committee, which will be finalised in August before returning to the board for approval in September. And I will be reviewing the standing orders so that any further amendments to those will be taken forward at the same meeting. This work is, of course, part of a wider programme of governance improvement alongside work on risk management, accountability and performance frameworks. I will leave it there and I will be happy to answer questions you may have.
Thank you very much. And to remind colleagues, this is to approve the structures in terms of references and membership. To note that the charity committee terms of reference are to follow. And I'd just like to thank Gareth for drawing to my attention the need to move one section from one committee to the other. So thank you. And really thank you all very much for the work that's gone into this. It's you know, we've done this in a very thorough and very swift way. Can I ask if there are any questions or any points that people want to make? Vicky.
I think just to pick up, thank you for the QIA documents that accompanied this, which is all very detailed, absolutely makes sense. But yourself had signed as well as, I can't remember, Kay, I think it was, wasn't it? Mm-hmm. But actually from a Chief Medical Officer and Director of Nursing, one of those need to be signing off a QIA.
Apologies, that has happened. We haven't got it in the document.
Yeah, the version that I've seen.
Yes, we'll make sure that we do that when we archive. Thank you.
Thank you very much. Matt?
I just need to make a point around, obviously, it's difficult allocating IMs to various committees, but all the best practice and audit guidance from Welsh Government and nationally suggests that we should have the IM with finance experience on that committee. It's a recommendation that you have the IM with finance experience on the audit committee. key recommendations.
We'll review that.
Yeah, it's just,
Thank
I've
you.
got to raise it professionally
Thank
because when we had a gap, I had to bring in someone independent as a temporary.
Thank you.
Thank you. Sorry, can I just, it would be really helpful to see that as that recommendation. I've seen the broad guidance, previous or recent financial experience, which is not the same as what you're describing, Matt. So that's the basis. Exactly, yeah. So that's the basis on which the committee membership has been worked up. And just to explain that one of the key drivers around this is the requirement in each of the terms of reference for cross-committee membership.
Yeah.
And that's been a very tricky thing to deliver. And we have that if we now move, and it not to say that, you know, if we're to meet good practice, we do have to move somebody around, we have to move a lot of people around to make sure that we have that cross-committee membership that the terms of reference that we have in front of us actually require. So it's something that I think
there may be some other solutions to it, but thank you. Yes, I think we should consider it.
Yes, absolutely.
We may need to ask. Yes. Thank you. Who else? Sarah.
Thank you, Chair. And this is a really exciting step for us culturally, I think, as an organisation. So I think it's important for us to reflect on that as a board. And from a personal perspective, this for me is a great example of truly having a voice personally as a member of staff, because I think I recall requesting a people committee in my interview prior to joining the organisation. So what a great example of you said we did together. I just want to say personally a huge thank you to John, Emily and Lindsay. We've had great passion, great discussion in terms of really challenging ourselves to think around how that committee would work and what it would do. And just wanted to reflect, given the organisation's ambitions, and where Adi and I really play a part in that in terms of cutting edge delivery of cancer and blood services, I can see that people committee will play a really critical role in shaping a workforce with the right skills, attributes and behaviours needed to take us from where we are to where we wish to be. So it just felt right, appreciating I will have the opportunity to do the first committee, and I wish it all every success in its future along with all of the others too. Thank you, Chair.
Thank you, Sarah, and thank you for working so well to help develop this committee. It's really very much appreciated, and I'm sure it's nice for you to see a legacy. So thank you. Lindsay?
Sorry, no.
It's an old hat. Okay. Anyone else? No. In that case, we'll take the terms of reference and the structure as approved, and I completely agree that this gives us a really great opportunity. We talked earlier about aligning the BAF to the committees. We talked about establishing a chairs forum. We talked about establishing a risk forum. And when we come to discuss this afternoon the board development, obviously this is half of what we're doing. Alongside this, it's how we operate effectively and efficiently as a great board within this new structure, and we will be looking at that integrated plan, which helps get us to that position as well. So thank you very much, everyone. So that's approved. Welcome, Alison.
Hello.
So we have you next. So you're going to present this item, which seeks the board's approval on two things. Firstly, the extension of the Student Bursary Award System software contract, and secondly, the awarding of the contract for the provision of material handling equipment lease, hire and maintenance. So could you please take us through these items?
Yes, thank you, Chair. Two items for approval today. The first one relates to the Student Bursary Award System. A comprehensive paper sets out what this is and what the role of shared services is in supporting and enabling this service to students who are accessing the bursary award. The request today is to extend the current contract arrangements from the 1st of April 27 through to the 31st of March 2030. The cost of that, excluding VAT, will be £382,000. The original business case was approved a number of years ago. At that point, the then Welsh Government were consulting on the future of the bursary arrangements. It was agreed that the bursary was continued. The recent Welsh Government also undertook a consultation on the future of the bursary arrangements, which did conclude in February of this calendar year. We're still awaiting what the new government wants to do with the future of the Welsh bursary system, but nevertheless, we need a system to support students in the near future. And so our recommendation and advice is to proceed with the extension, but we have built into the arrangements an annual review process. So it is a 1+1+1 extension, so that we can take account of anything that the new Welsh Government may direct in terms of the future of the Welsh bursary. I think it's fair to say that the risk associated with the system itself is that the system is fairly bespoke. It is tailored very much to the Welsh bursary system. So there is a significant lead-in time to change in supplier on this. So obviously the 3-year extension would also give us some flexibility then, once we know which is the way forward from the Welsh Government from a policy directive in terms of whether if a new system is to be re-procured in the future, it would give us sufficient lead-in time to plan on that. So seeking the Trust Board's approval for this today, Chair.
Thank you, Alison. Andy.
Thanks, Alison. Just one point of clarification. Is this just exclusively for medical students or wider healthcare? Because it's kind of a little bit ambiguous, and I notice it's rather GP UK. Which students specifically access the scheme? Just curious to clarify. Thank you.
In the main, it deals with the nursing bursary, but GP UK is the name of the supplier.
Okay, right. That's not okay. That's my confusion. Okay, so nursing students primarily.
Primarily, yeah.
But not exclusively.
Not exclusively, but I can follow up on that and drop you a line on that directly if that's helpful.
Gareth?
I'll speak in English in case Alison can't pick it up on the translation. Alison, just a point of detail, please, on the paper in Appendix 1, the commitment of expenditure, which is on page 285 of 881. And in that second paragraph there, it says the contract has been in place since 2022, and it's a 4-year term. So by my reckoning, it would have expired in 2026, whereas according to what's said here, it expires on the 31st of March 2027. It doesn't quite hang together, and I'm not quite sure.
I'm just looking, Gareth, because I've only got the paper in front of me, so I haven't got your reference in. So I'm just double checking.
Commitment of expenditure paper, and it's in the second paragraph on the first page.
You just bear with me, sorry.
Is that to do possibly with the 4-year term?
There was a bit of a lead-in time, Gareth, to the go live, I think, in terms of the 4 times. So we would have commissioned the service for the build stage and then the actual go live. So we're aligning the 3 extensions for sort of like the go live, if that makes sense.
We're looking at the service term as opposed to the actual commencement date of the contract.
Yes, but I take your point, and I'll make sure we pick that up in terms of any future contracts and requests.
Thank you.
Jill. Thanks, Chair. Thanks, Alison. Good to hear the update. just for colleagues to note that as well as the bursary scheme, Walsh Government are looking at the wider student support package, and particularly in the context of the current situation where we've got nearly 90 midwives, unfortunately, about to register in September who haven't got permanent positions to go into, and a couple of hundred nursing students. So government are really looking at this in the wider context, because with the bursary, of course, comes a 2-year tie-in. And if we haven't got posts, we're unable, of course, to follow through on that. So there's a lot of work. So that's why the delays, and it's taking longer than anticipated. Thanks, Alison.
Thank you. Thank you very much. We content to approve, colleagues? Yes, thank you. So Alison, if you will take us into the material handling equipment lease, please.
Yes, this one's a bit of a tongue twister, Chair. So this is the request for approval for the material handling equipment lease hire and maintenance. This relates to equipment that we primarily use in our stores, such as pallet trucks, lifters, floor scrubbers, to give you just a flavour of what the contract involves. It is a 5-year contract with a 3+1+1 structure, which will involve contract management and regular performance reviews with the supplier. The value over 5 years is just over £1 million, £1,040,000. The agreement is demand-led. There's no minimum commitment or commitment to expenditure or on volumes. I have included in the paper, we did revisit the Dun & Bradstreet risk assessment, and that is documented in the paper. I'm satisfied that that was to do with a timing issue in terms of submission of the accounts. And we have got the mitigation, as I said, that the arrangement for this contract is demand-led. So we're not paying anything in advance or on a regular basis if there were to be any further concerns. But as I've said, we will also have the contract management arrangements in place. So asking for approval, please, on this item.
Thank you. Colleagues, any questions? Yeah.
Hi, Alison, good to see you.
Hello.
Just to process one, might be wrong, from memory, because it's over 1 million, and whilst we don't have to ask ministers to approve it, we have to make sure they know we're going to award the contract. Just checking that's been done.
Yes, it's on the schedule that Jonathan Irvine's team send regularly to Welsh Government. Yeah.
Thanks, Alison. That's great.
Thank you.
Thank you. So I will take us through what we're being asked to approve. We're asked to approve the award of the contract. First of all, are we happy to do that? Yes. Secondly, the maximum estimated contract value of £1,040,000, excluding VAT, over the full 5-year term. Approved? Yes. We're asked to note that the expenditure will be funded from existing NWSSP supply chain, logistics and transport operational budgets. Control to purchase orders, yes. And to notice that that an initial supply financial standing concern is identified and has been considered, and that the approval score is now above what is needed. And then finally, to approve progression to intention to award, standstill and publication of the contract details notice, subject to completion of all required approvals. Are we happy to approve? Yes. Thank you. Thank you very much, Alison.
Thanks, Chair. I think I'm back later on in your day, in your session, so I shall see you later.
See you later.
Bye.
Thank you. Thank you. Thank you very much. That takes us on to the approval of a number of policies, and I believe all these are nationally mandated policies, save for the final one, which is the standard operating framework consultant job planning across Velindre University NHS Trust. And Sarah, you're going to lead us through these.
Yes, Chair, thank you. All of for approval, as you highlight, first policy in relation to childcare vouchers. It's part of our review, and the policy group updates are included and details are included. In terms of the second policy, family friendly and national policy, this is now presenting some of the other procedures and guidance around adoption leave, etc. I think when we originally issued the policy to the board, we had only covered maternity because of the extensive work needed to be done and to reflect across Wales. Wales. And then lastly, I don't know if Jazz wants to come in, but this has been a lot of work that we've been doing in terms of job planning across the organisation. They're all here for approval with the details set out in the papers. I'm happy to take any questions, and I'm sure Jazz would be in terms of the job planning if appropriate and necessary. Thank you, Chair.
Do you want to come in on the job planning? It's clearly very important for us.
Yes, please. I think that, you know, this has been a long time coming for us to get this piece of work done and get a policy together, which has been, you know, it's been evolved over a period of months, involved consultation with our BMA group, our consultants across the NHS in Wales with other medical directors, so that we adopted a consistent approach. And, you know, this has been contentious in areas as well. So what it's meant is that we've really had to develop our narrative, our thinking, create some consistency in approach. Having our digital system, which we procured and is fully in flow from July of last year, has really helped. And as you know, we have also managed to increase our job planning compliance using the principles that we have been setting and trained. So I think this is a really important piece of work. It will become much more apparent as we get into performance meetings with our Welsh government PNI colleagues. They will be looking to see what is your, you know, process policy, how are you complying with it, and what is your compliance overall. So it puts us in a strong position to have this work done.
Thank you. Are there any questions or issues to raise on any of these policies? No, I mean, in relation to that final policy, I just had a question and an observation. The question is, as we're developing the clinical governance with NWSSP, how does this fit? And could consideration please be given to that?
Yeah, so I think that this is the job planning policy for the blood service and the cancer service. That's how this has been developed in the consultation, etc. So this does not, you know, it's not seen as wider than that. And currently we don't employ clinical staff outside of the medical examiner's space through shared services. Single lead employers, completely different setup, yes, because they have contracts with the health boards. So they will need a job planning policy for each organization. And of course, we do have single lead employees that Velindre is employing to do the Velindre, you know, junior doctors or resident doctors, as we call them, on our rotas. So, but I think it's a good point in terms of checking in on how this aligns with other systems in place. But yes, to be very clear that this specifically relates to the two divisions.
Thank you. So is there an action to consider as part of the clinical governance
I think
plan?
Yeah, I think I guess what I'm saying is there isn't a particular gap at the moment for the applicability of this policy in relation to shared services as we stand. However, what we should do is describe the relationship.
Yes.
And we can pick that up through the clinical governance piece.
Okay. Yeah, that's very helpful. And then the other point that I had. Pardon?
Sarah was trying to come in on that point.
Oh, is she? Yes. Oh, sorry. Sarah.
Yes. No problem. I might be able to describe that relationship actually. As the employer interest, we are obliged to collectively bargain with our local partnership forum on behalf of shared services. This is something as part of the governance review I've already picked up with Gareth Hardacre, because the legislation indicates that shared services separately do not have the powers under the legislation in order to do this. So in terms of a consistency, as Jazz has highlighted, that's something we've been very, very keen to do across Wales to ensure parity and ensure attraction and retention of our medical staff. But it is my view that given that limitation in the law, that it should be a consistent policy that should be applied for that reason. It's a very particular piece of legislation around collective bargaining, Chair.
Thank you. So it'll be folded into that review then and included. Thank you very much. The second observation was that obviously completion of job planning and effective job planning service change is really important for a number of our strategic ambitions, and whether that will be reflected, for instance, in reporting to People Committee.
Absolutely. It is a metric that we report against. There is a national target which we currently are meeting, which is a 90% compliance. I think we might be the only organisation in Wales that currently meets that, but it's maintaining it, which is a challenge.
Yes, thank you. Thank you very much. Are we content to approve? Yes, thank you very much. That takes us on to the committee highlights, and we're going to focus today on 3 committees which have escalated issues for our attention, and I'm going to invite the chairs of those respective committees to lead us into what's been escalated and into a discussion around them. And I'm going to start with Vicky, please, on the Quality, Safety and Performance Committee.
Okay, so I mean, I think in the highlight report we reference the board assurance framework issues that we discussed earlier. So I don't intend to repeat it, but the paper's there for any reference, and happy to pick up any particular questions on the highlight report.
Any questions on the highlight report? No? Thank you, Vicky. In that case, we're asked to note, which we are doing, and we move on to Gareth for the Audit Committee.
Diolch, Cadeirydd. Yr unig pwynt o'n I am godi i'r fwrdd oedd ynglyn â'r gweithredoedd sydd yn codi oddi ar yr adolygiadau archwilio, ag roedd yna concern yn y pwyllgor bod rhai o'r gweithredoedd yna ddim yn cael eu cyflawni o fewn yr amser reiddiol oedd wedi ei roi iddyn nhw, ag wnaethon ni dweud fyswn ni'n codi'r bwrdd bod angen i'r tîm gweithredol bod yn cymryd mwy o bechnogaeth o'r gweithredoedd yna.
Diolch, Gareth. It seems to link, doesn't it, to some of the discussions we've been having already today in terms of reviewing the way we express outcomes and escalation processes, you know, the points that Kerry has made, the points that others around the table have made. So I think there is a linkage between the work that we've agreed to do and this, because ultimately the reformulated Audit and Risk Assurance Committee is the place where the overview of that will come together.
Mae hwn yn bwynt penodol ynglyn â gweithredoedd sydd yn cael cytuno gan y tîm gweithredol.
Yeah.
Yn ymateb i'r dargrymiadau sydd yn cael ei wneud yn yr adolygiadau.
Ie, dwi'n deall.
Felly maen nhw'n cytuno beth maen nhw'n wneud, maen nhw'n cytuno'r dyddiad, ond ie ddim yn digwydd yn aml iawn.
Diolch.
Mae'n rhan o'r...
Yes, Carl.
Yeah, I mean, I'll start off by saying I think we've made some progress on this over the last sort of 12 to 24 months, Gareth. I'm just double checking if I've read that correctly. We're not there yet, but I think we have. When I looked at the actions which were outstanding some time ago, I think we have made progress as a team. And if I'm wrong, you know, please correct me. 2 things, I suppose. One, yes, we need to own them. I think the second piece is related, isn't it, whereby I think there's a bit about systems and process, because one thing drives the other, I suspect. When the target dates are identified, the late requests for extensions, which are not acceptable to the committee unless there's a very good reason, I suspect more of a process rather than ownership, but they come together, don't they? So all I can say is, again, we just need to sort out the system process, and then hopefully that will help all of the executives do what we all want to do, which is give the committee the information assurances received. So again, perhaps Norm and I will pick that up offline, but I'm not going to give arbitrary promises and dates today. Can you let me take that away? Have a look at what actions are outstanding, who they're with, and then we will speak and come back with a well thought through date by which we can achieve those. Is that acceptable?
Ie. Dwi'n cytuno gyda Carl. Fe nath y sefyllfa wella yn nodweddiadol o le oedd e, ond dyn ni fel sy'n wedi slip o'n ôl i'n hen ffyrdd nawr.
Okay, that's useful to know that.
Yeah.
Thank you. Okay, we'll.
Yeah.
Okay.
So there's an action with Carl and the executive team. Thank you. Which takes us on to NVCC Project Scrutiny Subcommittee, which is Hilary, please.
Thank you, Chair. I'll just take the report as it's noted, but we just wanted to bring to the board's attention that you know, the project, as the report says, is entering a very complex stage and towards the end of its build process, and we were just wanted to advise that we're monitoring the programme actively. It is important to say that the contractor is still saying that he's delivering the project on time, but we just wanted to say that because of the complexity of it, we are focusing on the programme.
Thank you, Hilary, and you know, an awful lot of attention and work is going on in this area now. Carl, do you want to come in on this as SRO?
Yes, just to again, first of all, thank the committee for its good work and support, and just pick up what Hilary says. You know, there's two elements to it. Obviously, the building is outside of our direct control, and as Hilary said, we've got a real focus on ensuring we do everything to work with the provider of that building to get to the right space. I think my focus at the moment, alongside the executive, is making sure that we're ready then in terms of putting the service in that building. So and we're making very good progress on that. But I share the committee's view that as we stand today, the builder is saying everything is as is, but we are all really mindful that it is a complex program, and there is, you know, it's the obvious fact and thing to say is obviously as we get closer to the end goal, you've got less time to do things. That's just a matter of time, isn't it? But yeah, just to agree with what Hilary said, real focus on that, working with all of our partners.
Thank you. Are we happy to note? Yes. In that case, our next item is a number of annual reports for approval. We've got 9 annual reports at today's meeting. They've all been through QSP.
Yeah, we held an extraordinary QSP on the 9th, I think it was, 9th, and consider them separately so that we were given due attention, because we recognise as a committee an extraordinary amount of work goes into these annual reports.
Yes.
And we duly consider those separate to the business which we had QSP routine committee the following week, so that we could pay that attention. So we obviously endorse them for board approval.
Thank you very much. And can I just check, some of these statutory and some of these are discretionary. They're things that we've chosen to have annual reports on. So if we think about
I think we've can I just interject? We undertook a review, looked at this in detail last year, because believe it or not, we must probably had about double the amount of annual reports that we considered before. And that these ones that are coming through are the must-dos, and they are ones that the board need to consider. You know, some sound you know, a higher level than some others, but they are ones that we need as a board to be noting, and particularly for the committee that we need to consider.
Thank you very much. Questions, observations? Andy.
This is on the annual equalities reports. And this is page 622 of 881 or 5 of 17. I was intrigued by the age profile of our staff, and it's just an observation that we employ obviously highly skilled professionals, and so most the number in the very young category is relatively small, but there's a quite a big drop off between the 56 to 60 and the 61 to 65 age group, and this is something that is probably not surprising actually. You know, many people stepping away, retiring early, and so on, particularly in high pressure jobs. It just made me think about retention, because there's an awful lot of people potentially with a huge amount of experience seemingly, at least from this age profile, leaving the organization probably to retire early. You know, it just made me think that you know, we often talk about recruitment and retention, but retention in that very experienced group, it does look as though there's a very sharp drop off of people plus 60 in their early 60s. Not untypical, I suspect, within this within NHS, let's say, but an interesting observation. Not sure what we do about it.
Yes. Well, it certainly links, doesn't it, to the workforce planning that we've been talking about, and is one of the areas that the People Committee will be focused on. Certainly, and Sarah, I suspect you have something to say about that. You have your hand up.
Thank you, Chair. Yeah, very, very valid point, and one that we're discussing not only locally but across Wales in that context. So there has been a change in, and actually I'm going to say an unanticipated change in behaviour of those particular age groups post-COVID. To some extent, that has led to some of the challenges we've seen, for example, with streamlining in nurses and a midwifery space. So we've actually seen increased retention in some of those areas, and many people accessing retire and return. Now that creates different challenges for the workforce in terms of part-time working and what that means for continuity of care and support, etc. So it is a hot topic, and it is one that we are nationally working on as well as locally in terms of the future workforce plan, particularly for us in terms of the ambitions we have around research, development and innovation. It's going to be incredibly important for us not to be too scared of turnover, because that's naturally where the right skills, we will attract rotation of teams. So we may need to think differently in that space, would be my recommendation to the board, as opposed to other larger organisations, health boards, who are simply looking at that increased capacity in isolation. So I'm sure the People Committee will enjoy looking at that for you all.
Yeah, just if I may, final comment. So at Cardiff University, we do a lot in terms of rewarding long service. You know, we make a bit of a celebration when someone reaches perhaps 25 years service and so on. So I'm not sure what we do within Belinda in that respect, but that's just something that the university does. Yeah.
Yeah, we certainly mark it. John.
It's on that subject, and probably this is to Sarah. Sarah, we have exit interviews when people leave. Do we capture the reasons and why they're leaving?
We do indeed. It's voluntary. So that information actually was fed into our cultural baseline that was shared with the board earlier on in the year and was triangulated with the other information. I would say that we're not high in terms of numbers of that, John, but then proportionately compared to larger organisations, that's not unusual. It's about giving lots of different options, which we do provide. That for me connects to the psychological safety work that we've been doing, and we've recognised as a board there was a need for us to build that. The good news is the recent data on the WES, which will be coming to the board next time, we've only just had it, has acknowledged that our psychological safety is increasing, so we're moving in the right direction. And just to confirm, we do long service awards, and that will be part of the award ceremony that will take place in October.
And I send everybody a well done. Yes. Absolutely. Yeah, very interesting. Carl.
Yeah, just to make a broader point, which we won't debate today, but the people on Culture Committee and everybody else will need to. Just, I suppose, the changing nature of work and the way work's done in terms of technology, AI, and general intelligence. So we look at industries now which are completely transformed already about who's overseeing the work. So I think that will need to be part of how we think our way through this, because I suspect in 5 years' time, we're sat here today, we wouldn't recognise some of the way in which those services are being provided and how experts are overseeing service provision rather than doing. And secondly, 5 years hence that, I can't even start to think about that. So I think those are the sorts of things which really need to be brought together as well as the sort of age profile and things we just described in the last 5 minutes.
Very much. Anne, I'm sorry I missed you.
I think Sarah alluded to it, but in essence, in a previous organisation, because of the different pension schemes and the shift in those, what we saw was people wanting to retire from the 1995 pension scheme and, where possible, do some part-time work for a period of years in the 2015, isn't it? So it was how we created those kind of roles for people. And it speaks to the flexibility piece. And I think Sarah mentioned it, but it's harder to do in a small organisation with small group work, small workforce.
Thank you. Jill?
Thanks, Sarah. Just responding to Andy. So one of the ways that we're supporting our Beyond 60 is an excellent example, again, is the virtual assessment, the VAP service, virtual assessment pathway. So that's made up primarily of nurses at the moment, but it will be other healthcare professionals who've all worked for many years on the wards and can't do long shifts and 12-hour shifts. So they're really enjoying the opportunity to still provide that high level input scale assessment, but via the telephone and virtual means. So I think we'll see more of that.
I do that for chairing boards. Yeah, 60.
We talk about that, Chair.
Thank you. Thank you very much. So are we content to approve these annual reports and to note all the hard work that's gone into preparing them and the significant amount of very important information they contain? Thank you. Thank you. And thanks to your committee, Vicky, for reviewing all of these in detail. Thank you. So we've got professional registration, appraisal and revalidation annual assurance report. That's part of the report, isn't it?
It is.
Just a hangover on my.
If you want.
No, we're content. Thank you. Okay, that takes us on to items for noting. I've not been notified of any requirement for discussion, but I'm just going to go through them just to make sure. First of all, we have the trust seal report, just looking around the room. Then we have the chair's urgent actions, trust-wide policy approvals, extraordinary public quality safety and performance committee highlight report, the Public Strategic Development Committee highlight report, Charitable Funds highlight report, Local Partnership Forum highlight report, Shared Services report, and Shared Services Partnership Audit Committee highlight report, and finally the Joint Commissioning Committee highlight report. So we have noted those. That brings me on to questions from the public. So we always invite questions from the public, and we really, really welcome them. And we want to make sure that we respond to them in the meetings. And the way to do that is to come to the responsible director in relation to those answers. So we've received 2 questions from the public prior to this meeting relating to the sale of Whitchurch land. I am going to read out question 1 and then come to Lauren to provide a response. And Lauren is also providing a written response to the individual who's raised this question. And the question is about the long-term protection of the sports clubs And can the board confirm that the successful purchaser will be contractually required as a condition of the sale to protect the long-term viability of the existing sports clubs and their operations? And if so, how that protection will be secured and enforced?
So firstly, as the board has discussed a number of times, just to summarise how we are committed to ensuring the sustainable long-term future of the sports clubs. So that's cricket, football and bowls, who are leaseholders on our land. So to this end, we have to date firstly featured the sports clubs very clearly in the promotional material, which included a lot of work from each of the clubs themselves in terms of how they wanted to describe their role and their impact on the community. Secondly, we have facilitated the co-creation of the community requirements of the site, which strongly featured the sports club's input and then the reflections of the rest of the community on the importance of those clubs as well. Thirdly, we've included the assessment in the of the potential buyers' commitments to the clubs in how we assess the quality of the proposals. And finally, we continue to work closely with Cardiff Council and CADU on the protections for the sports fields, both from a planning and heritage perspective. So that's the background. This question was specifically from cricket, who are going into their 125th anniversary next year. So this is a when we talk about heritage, they have a long one. So on the specific question, we've discussed this question previously with Cardiff Council, and the view was it would be unusual because effectively we'd be having a condition of sale to apply with planning requirements, because it is a planning requirement to continue to have those spaces as sports fields. However, I did discuss, we have regular meetings with each of the clubs individually and collectively, the most recent one of which was at the beginning of July. So we have agreed that we would review this further, and we're testing with our legal, planning, heritage and commercial advisors as to whether there are mechanisms we can use and may want to consider in terms of securing this further. So when we have next discussion with the board on this matter substantively, which is planned for, all being well, the September meeting, I'll be able to feed back on how we've progressed with those plans.
Thank you, Lauren. Does anybody want to add? No? Thank you very much, and thank you for the engagement that you have with the local community around this. It's incredibly important, really important for us as an organisation, and we really welcome their reciprocal engagement with us. So they're our neighbours, and we very much value them. So thank you very much. Oh yes, I thought you answered that in terms of the cricket club, but the second question is, given that Whitchurch Heath Cricket Club and the other sports clubs have operated on the site for decades, which you talked about, they're asking about the agent of change principle being reflected in any future redevelopment so that sporting activities are protected.
Yes, so it's important to clarify specifically on this question that the agent for change principle is part of the national planning framework. So it's not a matter for the trust, it'll be for a matter that the new developer has with Cardiff Council when they're going through the planning process. However, we have been really clear on some of these. So the agent of change, for those who don't know, are basically ensuring that a new development takes into account the requirements of the existing use of that space. So the example that's often used is if you have a new housing development next to a nightclub, you shouldn't be asking the nightclub to change their hours of operation and their noise reduction. You need to build the noise installation of the new development account for the businesses and community use that's already there. So so we've had that in view as we've been going through the engagement. A specific point which came up recently was on the planning requirements for the clubs, because particularly on evenings where there's lots of children's teams. I mean, the football club have over 40 teams operating on a throughout the season. A number of which are children's clubs. So both in the evenings and then for matches on the weekend, there are significant parking use of the overall site. So that's something that the new developer will need to be really clear on to ensure that that is accommodated appropriately. So we are working with the potential bidders so that these types of matters are built into their plans as soon as possible, and have been already. And parking is something we're picking up with them specifically at the moment.
Thank you very much. Thank you. Okay, so I've not had notice of any other business, but there is one really important piece of any other business, which is that this is the last meeting that we have Professor Andy Westwell with us. And we're going to really miss him because he's been such a dedicated member of this board. And I'm going to ask Vicky to say a couple of things, because I think you were appointed at around about the same time, weren't you?
Yeah, we were. So I think you started in the August and I started at the beginning of December. Yeah. So it seems they're about the same time. But I mean, I think, I've been watching you. I've been part of the RD&I committee. And watching you chair that has been really wonderful, because I think working with Jazz, I think you've had a really close working relationship where you've really developed the agenda, developed the strategy, and that's been fantastic to watch. And it is really watching because you've done all the detail. But I think using your expertise at board, but also at committee level, has been lovely to see. And obviously we regret that you're having to leave us. But I know that you'll do great things in the university as well in your new role. So we wish you well for that. But it's been lovely working with you, both at board and in that committee. And I'm sure, others will want to say something as well. But it's been lovely. And it feels a bit odd with you going and sort of still, keeping on going. But no, thank you for all that you've done. Well, and it's been lovely working alongside you.
Yeah. And you have made a real impact in that research space. I'm going to just ask Jazz to say a couple of words.
Yes, thank you. No, absolutely. I think you've got a fantastic collaborative style which puts people at ease, Andy. And I think across the whole RD&I team, that's the real message that comes back. People feel comfortable to speak to you. I think you've challenged us, but always with evidence. And I love that style of not challenging for the sake of challenging, but really where there is something to change, to develop. And in the last, I think 5 years it is or so, we've done many things. We've written an RD&I cancer strategy. The Blood Service have just refreshed their strategy. We developed CCRP. You helped us on every step of that journey, some of which was quite tricky to land. We've developed the Cardiff Health Partners. You've been a significant key member of landing that. I think our whole relationship with Cardiff University in particular, but also Cardiff and Vale, has evolved through these partnerships, so that we are equal players around the table. And I would say 5 years ago it was a very different position. So I think just to recognise all these things that you've been pivotal in doing. Many, many thanks, and all the best.
Thank you. Really appreciate that, and it's genuinely been a pleasure and a privilege actually. And there's a lot has happened. I've learned an awful lot as well. And I won't close the door on Velindre. I stepped into another big head of department job in the university, but who knows in the future, always be close to Velindre. And I'm not very far away. I'm still in an office in Cardiff, right? So thank you, appreciate it.
So in the private board, we've got a little something for you, and I'm sure more people will want to say things. But I think it's important to acknowledge the roles that independent members like you play. It's probably, not that people probably don't know what expertise, what time, what commitment, what a real passion for the organisation that independent members have and bring, and the difference that they can make. And you certainly a demonstration of that, Andy, and it's really good to publicly thank you and acknowledge the role that you played. So thank you very much. Thank you. So the next public meeting will take place on Thursday, the 24th of September 2026 at 10 a.m. at the Welsh Blood Service, as the service notes its 80th birthday. So that takes me to closing the meeting. I'm asking the board to adopt the following resolution. The board is asked to adopt that representatives of the press and other members of the public be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest in accordance with section 1, subsection 2 of the Public Bodies Act 1960. And that brings the meeting to an end. Thank you very much. Thank you, everybody. To those who are staying on, we